A patient arrives in the emergency department with nausea, vomiting, and deep, rapid breathing. At first glance, it may look like dehydration or a stomach illness, but experienced nurses know that these signs together can point to a dangerous metabolic emergency. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Diabetic ketoacidosis does not happen suddenly. It develops when insulin is insufficient, causing the body to break down fat for energy. This process produces ketones, which make the blood acidic. Nurses do not need to calculate biochemical pathways, but they must recognize when the body is spiraling out of control. Imagine a 22-year-old patient with type 1 diabetes who missed several insulin doses due to illness. The patient appears weak and dehydrated. The skin is dry. The breath has a fruity odor. Respirations are deep and rapid. Blood glucose is significantly elevated, and vital signs show tachycardia and low blood pressure. At the bedside, the nurse immediately prioritizes assessment using the ABC framework. The airway is clear. Breathing is rapid and labored, signaling metabolic acidosis. Circulation is compromised due to dehydration and fluid loss. These findings demand urgent intervention. DKA affects multiple systems at once. Severe dehydration reduces circulation. Acidosis disrupts cellular function. Electrolyte imbalances, especially potassium shifts, increase the risk of life-threatening arrhythmias. Nurses must understand that correcting one problem too quickly can worsen another. The nurse establishes IV access and begins fluid resuscitation as ordered. Blood glucose, electrolytes, urine output, and mental status are closely monitored. Insulin therapy is started carefully, with frequent reassessment to prevent sudden shifts that could harm the patient. This case highlights the importance of trend monitoring. A falling blood glucose level does not mean the crisis is over. Electrolyte changes and acid-base balance must stabilize as well. Nurses remain vigilant throughout treatment, not just at the beginning. The nclex often tests DKA through indirect clues rather than naming it outright. Deep breathing, dehydration, hyperglycemia, and altered mental status together signal metabolic acidosis. The correct answer usually focuses on restoring circulation, correcting imbalance, and preventing complications. In real nursing practice, DKA management is a team effort, but nurses play a central role in continuous assessment. Early recognition, careful monitoring, and timely communication prevent rapid deterioration and improve outcomes. Now that you have seen how nurses identify and manage diabetic ketoacidosis in a real clinical scenario, the next step is understanding how technology and data support modern nursing decisions. That transition leads naturally into nursing informatics and the role of data in patient care. And that's exactly where we'll go next here at the Learning Studio.